So this is the course of the facial artery. It terminates in this case now into the lateral nasal artery. If we would like to inject hyaluronic acid here in the alar region, we have to be very, very superficial or deeper, but not in the middle. Because here in this region, the artery will be very, very superficial. Not very superficial, but more superficial than it was. I would like to measure for you how deep is this artery. It's 3 millimeters deep, 2 millimeters, 3. But here it's almost 4 millimeters deep. Let's see again the entire facial artery system. This is what we have from the mid-mandible. We have an inferior labial artery. It's now in this case very, very, very low. Then we have a superior labial artery. This artery is again very deep in the muscle. And then we have the continuation of the facial artery towards the ala, and here it will become quite superficial, but you can still inject very, very superficially. Here it's safe to inject superficially, and then it's more risky as you are closer to the ala. And then here we have a terminal branch. This is the lateral nasal artery. In this case, this very, very little branch is the angular artery, but we have angular artery just from the supratracheal system. I would like to show you the supratracheal system, which can be seen here. Here we have the main trunk of the supratracheal artery, and this will be the supratracheal artery, and this will create the dorsal nasal artery and also gives rise to the angular artery. But actually all of these branches are in this case very, very small. So and obviously this is between the depressor supercilii muscle fibers. So let's talk about the facial vein. The facial vein is straight from the mid-mandible towards the medial canthus, and we can see clearly that the facial vein is really, really deep through the in front of, anterior to the masseter muscle, in the substance of the buccal fat, and then it becomes superficial, crosses the malar fat pad, which is a superficial fat pad, and then it will travel always between the fibers of the orbicularis oculi and the levator labii superioris alaquae nasi muscle. So this is the levator labii superioris alaquae nasi. This is the orbicularis oculi. And then this will be the angular vein. Here is the angular artery, here is the angular vein, and both of them are superficial to the medial canthal ligament.